Welcome everyone. Happy Tuesday evening. Wow, do we have something special planned for you all tonight? And of course, for those of you watching the replay. So every Tuesday night we come on here, we share the science and technology of how LifeWave patches work, and of course, get all your questions answered. Tonight, I have two very special guests that I'm so honored and privileged to be working with for the last several months in LifeWave, and they have got amazing information to share with you. Again, wrapping up our Heart Healthy Month. That is what we're focusing on this month with heart health for February. I have Dr. Mario, who is a cardiologist of over 40 years. I have Dr. Pamela, who is an acupuncturist of, well, I think almost 20 years now. And so, of course, I'm going to let them share their personal backgrounds with you all, but they are going to focus specifically on the heart tonight and how LifeWave's technology can benefit your cardiovascular system from their own areas of expertise, where East meets West. I love that. So I want to first share with you the disclaimer, of course. LifeWave, the information shared tonight, this technology is not intended to treat, cure, or diagnose anything at all. Of course, please check with your healthcare provider, your practitioner, if you have any questions about your health, if you're on medications, pregnant, or nursing. I am a doctor of integrative medicine and functional medicine. Dr. Mario is a cardiologist. Dr. Pamela is an acupuncturist, but we are not your physicians. And so the information we're sharing with you tonight is information based on our own research and data and findings, and of course, usage in our practices. So with that being said, let me go ahead and get Dr. Mario on here. Hi, Dr. Mario, how are you?
Hi, how are you? Hi, everybody. It's a pleasure to be here and very excited to be able to share some of my information with you. Just for those of you who do not know who I am, I've been a cardiologist, as Dr. Stacy said, for about 40 years. I was an interventional cardiologist, and for the last 5 years, I became a clinical cardiologist. I'm very proud of it. I love what I do, and I live for my patients and the health of my patients. And I was introduced to the LifeWave patches about a little bit over 4 months ago, and it was a life-changing experience for me. And the first thing I thought about was about the health of my patients, or what I could do to improve my patients. That was my first thought. I really didn't know much about the patches when I was introduced to them, but I knew what they did for me, and I knew that I would be able to help a lot of patients with that. I have been in Charlotte County now for about 36 years, and I'm still going strong, and I hope to be around for a long time. And I'm already helping a lot of my patients with the patch technology. And that's it. That's a basic introduction. I went to med school in Dominican Republic, Spain. I did all my training in New Jersey and Philadelphia. And again, I've been here for 36 years. So happy to be a US citizen, happy to be a Florida resident. And we live in paradise down here. So.
Yes, we do. Thank you, Dr. Mario. Okay, so Dr. Mario, talking about obviously heart health and the patches that benefit the heart. Last week we had talked about the X39, the X49, the Aeon, and the Carnosine as having different roles in benefiting the heart. And of course, we know with our science and technology, we are talking about a non-transdermal patch. This patch signals your body to activate its own specific peptides depending on the patch in order to help the body get into balance, into homeostasis, and impact our different systems and organs in our body. So could you share with everyone from your perspective, your point of view, and obviously your research and usage of the technology, what would you recommend, or what would you say have you found to be beneficial? Which patch would you start with that you would want to tell everybody about tonight?
Well, the first thing I would like to share with everybody is the incredible mind of David Smith that created the technology. I mean, this is something very revolutionary, and is genius invention. I think to be able to come up with a very simple way how to reflect your own energy, infrared lights, electromagnetic energy back into your body at different frequencies that affect different organs and chemicals in your body is something incredible. It's like futuristic.
Mhm.
So, and this is not delivering any medicines to your body, to your system. So that's the number one thing that I want to say is this is just an incredible technology, and it does work. We have those 4 patches that Dr. Stacy mentioned. I think they all complement each other, but I usually start with the X39 patches. And believe it or not, most of my patients that come to a cardiology office, most of their symptoms are musculoskeletal, believe it or not. A lot of them also complain of tiredness, of fatigue, of not being able to breathe well, etc. But we know that the patches, the X39, improves, gives you vitality, energy, activates the stem cells. So the X49 as well. The Aeon patches regulates your autonomic nervous system, where the parasympathetic and the sympathetic system become more in tune with, more balanced with one another, so it can regulate your heart rate and other systems. These patches also lower your fibrinogen levels, also decreasing the viscosity of the blood, the thickness of the blood, and making you less prone to having heart attacks and strokes. That's an impressive quality of the Aeon patch. I think a lot of the benefit of the Aeon patch and even the X39, because the difference between the Aeon and the X39 is just one amino acid in the structure of the peptide, of the protein. I'm sorry. The only thing is that the X39 is accompanied by a copper molecule. So but they're very similar. So there's some cross effect between the Aeon and the X39 and the X49. So I think they all complement each other very nicely. The fact that they give you energy to exercise, to move, to lose weight, to give you better sleep. It makes you thirsty. Some of these patches do make you thirsty, so it increases your water intake. And this we already know that hydration, oxygenation, activity, keeping your weight down, improving your diet is the key to a good cardiovascular health. I mean, we cannot do anything, no matter what medicine you use or what method you use of treating cardiac patients. If you don't follow rules, you will not be, I cannot be successful, and nobody will be successful. So this is a partnership between providers and patients. And as I said, the partnership needs to work. It needs to work both ways. So I think the patches have become an incredible complement. There's a lot that I need to learn. There's a lot of experience that I need to gain in my practice with my patients. But so far, the experience has been incredible. I have patients who have Parkinson's and neurological disorders. I'm already helping them. The cognitive improvement in patients has been incredible as well. Their activity level, their strength, their optimism, the less pain, the being more up and not depressed. It's just incredible. It's an incredible array of symptoms that basically has to do with what each individual experiences, because we are all different. We cannot expect to have the same response on everybody. But I can tell you that just about 95 or 99% of the patients do have more energy. They sleep better. They feel better. They can exercise. I have a patient with dementia that I saw today who's now riding the bicycle. He looks, I see him just about every couple of months. He looks better now than ever. So the patches work. I think it's a wonderful complement to the therapy, and there's a lot more that we are going to find out about the patches in the future as we use them more in cardiology. The Carnosine patch is a great patch, not only to increase longevity and improve, lengthen the telomere and hopefully make us younger, but also improves brain function and cardiac function and cardiac performance. So I think that's another complement that we can use with the X39. So it all depends. We need to tailor all these different patches to what we're treating or what we want to accomplish. But I would certainly start with the X39. Like I tell all my patients, you know, let's try 3 months of the X39, and let's see in 3 months what it is that we need to tailor to your particular needs. Is it cognitive problem? Is it more less pain, and is it more endurance? What is it? And then we will go from there. But I would definitely start with the X39. I think it's an incredible technology, it's an incredible formula, that would be my my patch of preference to start with.
Absolutely. I love it. And I agree. X39 signaling your body to activate GHK-Cu, copper peptide, like you mentioned, elevate that, mobilize our stem cells, your stem cells go to work to repair and regenerate whatever is needed in your body in whatever order. Obviously, we can't pick, which is why I love that we talk about some of these supportive patches. With the X39, we use the Aeon, the Carnosine, and the X49 as needed per person, right? Individual, of course. I love that you said that. That's what people have to understand. This is an individual basis on what's going on with you. But we use those supportive patches to be able to support those specific systems, the things that you mentioned that the other patches do to help with cardiac function, of course. You know, I do have several questions in here, Dr. Mario, if you don't mind if I just ask real quickly right now. A lot of people are asking if they're on blood thinners or other heart medications. And obviously we cannot give medical advice. You know, you all know that. And so just as a general, if you're on any medications, what would you say to someone using the X39?
For example, the question about the blood thinners, I have not seen a change in patients who are taking blood thinners with the X39 patch, not at all. I have given the patches to patients who have had major cardiac surgery, bypass surgery, aortic root replacements, aortic valve replacements, and they're all doing great with the patches. They right now they're regular subscribers to it, and they believe in it, and knock on wood, I have not had any major problem with anybody.
Fantastic. Well, somebody's asking about the Aeon patch because you had mentioned fibrinogen. Fibrinogen is one of the inflammatory markers in the body, and we can see a correlation with elevated fibrinogen level, the blood being clumpy and thick, as you mentioned. And of course, with that, would Aeon reduce the you know, the thickness of the blood, or maybe even make it too thin? And I want you to answer that, but I also want to share from my personal experience. My daughter had low fibrinogen. She had a blood clotting disorder since she was around 3 years old. And so that was my first question to David Schmidt, because her fibrinogen was almost below 60, which, you know, you can bleed out, right, very quickly after that. And so I asked him, my concern was if she had low fibrinogen, which she did, she had a lot of bruises, very simple little bumps would bruise profusely and be there for weeks. And he said, these are his words from David Schmidt. He said, this patch will never bring your fibrinogen level out of balance. It will never take it too low. It will only bring it into balance, because hers was so low. It actually brought her fibrinogen level up into balance to where she no longer bruised. We had an entire year of using X39 Aeon, and we used Carnosine as well too, but X39 and Aeon that brought her blood clotting factors back into balance. So I have to say that from personal experience. Have you had any experience with anyone, or what would you say to that, Dr. Mario?
So remember, fibrinogen levels goes up as an inflammatory reaction to the body. So going back again to the basics, and the basics are be healthy, do what you need to do for yourself. Diabetes, hypertension, obesity, lack of exercise, poor hydration, not sleeping well, lack of oxygen, lack of fresh air, all that can be inflammatory. And I think if we reduce our own personal inflammation, there's no major reason, unless there's a genetic problem where the fibrinogen levels would be high. We need to correct blood pressure. We need to be tight on the diabetes, improve the diet, lose weight. Come on, we have an obesity problem in this country. We have a food problem in this country, and we need to be health conscious. I practice what I preach. I keep myself on a regular exercise program and eat the right things as much as I can. Am I 100%? No, I like to do, I like to have fun every once in a while, but I try to keep myself in line for as much as I can. And I think if we do that, we should not have to worry very much about fibrinogen. As I said, it's true that there's people with genetic conditions, and there may not be a whole lot that we can do about it, but I think things like Aeon and doing the right thing and other means of treatment can help with that.
Wonderful. Well, thank you. I would love for you to share your personal experience with the patches. What you've used and what you found is very profound. Obviously, we heard you, for those of you that were there in Sarasota last month for our big event with David. We heard Dr. Mario on Friday share his personal testimonial, but you know, Dr. Mario, there are over 430 people on here, so they may not have all heard your experience using the patches. Would you mind to share with everyone?
Do you have a couple of hours?
That profound, right?
Yeah, I mean, it's like these patches have turned my life around. I mean, we're starting from lumbar radiculopathy to left hip osteoarthritis to cervical spine disc problems to carpal tunnel to plantar fasciitis, to GERD, and it's all went away. It all went away 90% from day one. A couple of more things that have been stated in some of the testimonials in all the different podcasts is I have been gray, God knows for how long. Believe it or not, my hair is starting to turn black again. I cannot believe it. I mean, I have black hair coming out. It's incredible. I've had a problem with receding hairline. I mean, receding gum line for the longest time, which I think may be traumatic, could be also genetic stuff. My gums are growing back again. I mean, there have been testimonials, including by one of our senior presidents in the company, that she was the one who stated that she had regrowth of her gum line. Well, it's happening to me.
Wow.
So it's like what I tell the patients is, you know something, try the patch. I'm not going to tell you all the benefits that you might get out of it. Try it for 3 months. Tell me at the end of 3 months, besides from all the things that I think is going to do for you, tell me what else you notice that all the benefits that you are deriving from it. Fantastic.
Well, they want to know what patches you're using.
Well, I regularly use the X39, the X49. I use the Aeon patch. I use the Carnosine patch. I use the glutathione either every day or every other day, depending on what I'm doing, and that's basically it.
Fantastic.
Yeah.
Oh, that's amazing. Our Fantastic Five. That's what we call that. Our Fantastic Five.
Yeah.
Wonderful. Well, thank you so much, Dr. Mario, for being on here tonight. Thank you for sharing your wisdom, your knowledge. And I know you and I have a call with David coming up here in the next week. And so we're going to be talking about some really important things that you're going to be doing in your practice with your, as you mentioned, with your patients that have symptoms of Parkinson's and other things. So I'm super excited from that. And I'm sure we'll have you back on here again once that gets up and underway and you can share what you're finding.
Anytime, my pleasure. It's a pleasure to be here, to be able to share this moment with all of you.
Wonderful, wonderful. Well, thank you, Dr. Mario. Thank you, thank you, thank you.
You're welcome.
All right, Dr. Pamela, welcome. How are you this evening?
Good. How you guys doing?
Doing well. Well, we heard the Western medicine philosophy here and beliefs, which I love. Obviously, Dr. Mario is not hardcore medication only, but I love that he, obviously is very open to other things and sees the power and the technology and how this is and how this works. But, our patches, the foundation of them is actually rooted in traditional Chinese medicine. Because when you look at our clinical studies, you see that, we use TCM, we use those different acupuncture points and meridians to be able to show the effectiveness, as Dr. Mario mentioned, on how these patches are impacting the organs and the systems in the body. So I would love for you to share your background And then just let me know whenever you would like me to pop open your screen. I have your slides ready to go. So we're excited to hear what the East says about this technology and how it can help the heart.
Good. All right. Hello, everyone. Thank you, Dr. Stacy, for inviting me as your guest to your Zoom call today. So, so my name is Dr. Pamela Purse. I'm a doctor of acupuncture, and I'm a licensed acupuncturist in the state of Florida. So I've been in practice for almost 14 years. So my specialty is chronic pain, neurology, neurological disorder, and hormonal disorder. So, you know, men and female and male. Okay, so I was introduced with LifeWave back in December last year. So my friend reached out to me back in May, but I was like so busy. I was like, just put them aside. And then when I had my break during December timeframe, I was like, you know, basically like entertain the idea. And then I tried the first patch. That was the X39. So I was like, wow, what is this? You know, it basically like, you know, wake me up, like basically like, you know, if you feel like a different person. So I was like trying to find the information for that. I said, what is this? So basically, when I learned about the copper peptide, I was like, man, this is like basically what I've been trying to like create. Like this is like acupuncture and masturbation in one patch. Like this is no brainer. So basically you don't have to carry your infrared light because in clinical setting, right? So when you treat patients, I use infrared light to basically like help, you know, stimulate the process or like help support the process. And you use masturbation. So some probably not sure what is masturbation. Masturbation is basically heat therapy. It's a mugwort herb that you put on the specific point to stimulate, like basically create the heat so it travels faster through the meridian. So, but I think David Smith read all the ancient texts and just put it in one patch. And I was like, well, this is no brainer. So all I got to do is basically just like put them on the specific point that I already know the combination. Obviously, you know, I know many combinations. So like today, I'm going to share a few of them with you guys and how I use it in clinical settings.
Fantastic. Thank you so much, Dr. Pamela. I love that. Instead of having to carry your, whatever you call that, your light around.
No, you don't have to, you don't need any acupuncture needle. So if like in the future, right?
Yes.
In the future, basically you don't, you know, patient that's scared of needles, scared of like getting acupuncture, you basically know this is like copper peptide. Copper and needle, metal, it's the same thing. It's a mineral.
Correct.
So same.
Perfect. All right, here we go. So all I want you to do is tell me when you want me to change your slide to the next one, okay?
Perfect. Okay, can we go to the next one, please?
Of course.
Okay, so this is what we're going to cover today. So we're going to cover briefly on how the traditional Chinese medicine view heart. And then we're going to go like briefly on how we do that in clinical application. Then I provided 4 examples over here on how I use the acupuncture points together with the patches, and I provide, you know, sign and symptoms. So obviously the sign and symptoms is very general, but some of these symptoms is just like out of your mind, like, huh, somebody has that? Yes, I do see some of these symptoms in the clinical setting. So that's the reason why, you know, I know to go to check their heart before I, you know, make, you know, the actual diagnosis.
Okay.
All right, next, please.
You got it. Can you see that okay?
Yes.
Okay.
Okay, so in brief, the way the Chinese medicine, the traditional Chinese medicine view the heart is basically you have to know where is the location. The heart is located on the chest and enclosed by the pericardium. So basically we look at the pericardium as the protector of the heart. Okay, so in TCM, the function of the organ is to govern the blood vessel. Basically, like it holds the blood vessel so it won't like splash away, and also store the spirit, and it opens through the tongue. So it means the heart propels the blood through the blood vessel. Okay, so that's how you get like a good heart. Like you don't have any pain. You know, if you have good blood flow in the heart, you don't have, you know, pain or, you know, palpitation, all that stuff. And also it governs consciousness and mental activity. So in clinical, in ancient texts, it says, if your heart is disturbed, right, your spirit cannot reside. That's how they concluded that if somebody has mental activity, mental disturbance, right, the heart is disturbed. So that's when we come in and make sure put the specific point to help this patient. So again, ancient texts also said the heart is great governor of the 5 viscera and 6 bowels, and is the board of the spirit. So this is how important heart is. If your heart is not working properly, all the other organs gonna fail. So all the other organs gonna be upset. So you have to take care of your heart. All right, next please.
You got it.
Okay, so in clinical setting, the heart channel, we mainly use the heart points or the heart channels basically for the disorder of the heart and chest, for mental or any emotional disorders, or any type of internal heat. When we say internal heat, we basically look at the tongue, because some people say, oh, my tongue, I got ulcer, I got all these kind, like tongue cancer. It's also, you know, probably has to do with heart problem as well. Okay, next please.
Okay.
So this is gonna be the first case, first combination. So this is very important. This is basically like, I'll teach you the location. So this is gonna be for any cardiac pain, any palpitation, PVC, okay, any chest stuffiness, right? You feel it like right there, and you just like feel uncomfortable. So you can, you know, the location for the heart 8, 6, and 7, right? Which I combine the SI11. So the first one is on the right. I always combine the right and left, because we have to make sure the right brain is talking to the left, and then the left is talking to the right. So you don't have to be very specific. The way you locate, you just remember the pinky, right? And then you get to the midi part. So this is all the heart 5, 6, and 7. So all you got to do, you just take one patch and you put it over there. Don't overthink. You just put it over there, and you feel the stimulation right away. Not stimulation, like feeling good, like, oh, okay, all right. But and I combine that with X39. I love X39s on the SI11. SI11 basically like on your scapular blade, right in the middle. If you press your scapular blade right now on the left, it's gonna be sore. Why? Because everybody is anxious about whatever in their life right now. So if you press it over there and you put X39, you're gonna feel like a little bit radiating, like soothing thing, like just open up the chest, and it makes you like grounded. Okay. All right. Next slide, please. Okay. So the next one is more on heat presentation. So this is for any type of rashes, like you go see the dermatologist, and then dermatologist said, no, you're good. You know, they give you tons of medication and you still have these rashes. Like, I don't know where's these rashes coming in from. So basically, this is the thing. You have heat in the heart, so you have to reduce the heat from the heart. So I use glutathione for this one because the glutathione has the property of like remove the toxin. So heart 8 is basically like on the right. All you gotta do, use your pinky. You just like do it over there. If you press it over here, you're gonna feel it like painful. This is true if you been angry all week. Yeah, like there is like pent up emotion. like you angry and you're not satisfied with life. So if you press the point right now over here, you're gonna feel it tender. So you can put glutathione over there and you feel like, right away. So anyway, moving forward. So I like to combine them with splint 2. Splint 2 on the base of the feet. So your big toe, this is your big toe. So it's gonna be like right there. If you press it right now, right, you're gonna feel a little bit tender on that area. So I love X39 on that area because X39 has the property of like rejuvenate the area, like just send the information and it travels and reduce the pain. At least this is true in my case. Okay, you know, things happen in life, and when you're like, my God, I need to get this one, that, blah blah blah. So if you need like a little bit grounding, so you just put one patch on your heartache and then one patch on the splint 2. I call it splint 2. It basically clears some damp heat, especially on the lower part of your body. Okay, and then next slide, please. Okay, the third one is, so this is mostly on if you're doing some detoxification. So this is very good if you have too much phlegm. What I mean by phlegm, right? First, if you have an unresolved grief. What I mean by unresolved grief, we probably 5 years ago, somebody died or somebody like got divorced or somebody like, you know, major things happen in his life. So you basically just put it aside, right? You have it in your chest, but you think you like good because you have this medication to like help you suppress everything. But actually you're not actually do healing or addressing the root of the problem. So if you put these 2 points, Aeon on the right side, on the elbow side, so this is basically heart 3, okay? And then you combine with left medial knee. If you palpate this area over here on the left medial knee, it's gonna be tender. So liver 8 is like, in my opinion, in the way that I use it, is a major detox point. So when I was in Sarasota, when was that? Last month we were there, right? And I didn't talk much because I was like detoxing, like I was like coughing. Like I said, I'm not sick. I'm just like coming. This thing is just keep coming out, and I feel good, but it just keep coming out. But once it's out, it's basically clear you out. So this is perfect for those have thyroid problems. Okay, thyroid problem, any flame, any type of lump in the breast, any like things like lump in your uterus. This is a great point for detoxification. And I love these 2 combinations because Aeon basically like a good, you know, lowering the cortisol, which is like address all these hormonal issues. And then glutathione is basically major detox. It's basically like, I call it the excavator. So yes. Okay, next please. And then that's the last one I put in. Okay, so this is the last one. Okay, let's see. Okay. So this is a special combination. Lung 7, kidney 6. Let me see here. So lung 7, kidney 6. Lung 7 is basically on your wrist, like right there between these 2 tendons on the thumb area. So right there. So don't overthink, just put it there, just put it right there. And then you combine with kidney 6, like below the medial ankle. So inside your ankle, there is like a bone, and then it's right behind that. I mean, at the below. And then you just put it the patches. So I love this combination 39 and 49, X39 and X49. So the reason why I like this combination, because it connects, you know, it connects the uterus, you know, the uterus, the kidney, the stomach, spleen, heart, and lung. So it connects this point combination address big area instead of like on the specific area. So it basically like it goes to the uterus, it starts with the uterus, and then it goes to the kidney, and then it goes to the stomach, spleen, heart, and lungs. On all these organs are basically working it together so you can get better or you feel better. Okay, and then this combination, lung 7 and kidney 6, is mainly used to circulate the blood. Remember when we the brief explanation on the function of the heart is basically govern the blood vessels. So it helps circulate the blood and essence and body fluid, and it nourish and lubricate all the organs, not just the heart, the lung, the liver, the spleen, the stomach, the large intestine, the uterus, everybody inside there. So everybody gonna be happy if you just use these two. All right, and one more thing, I didn't put it on the slide. This is like very important, but it's always overlooked. So in this medicine, okay, the uterus, physiologically, physically, like the uterus physically is related to the heart through the we call it the bowel line. So the bowel line. So basically, the uterus is your second heart. So that's the reason, right? That's the reason why if somebody having difficulty on getting pregnant or keep getting miscarriage, they are encouraged by their GYN to seek acupuncture treatment to just calm their heart so they can get pregnant naturally or like make the IVF successful. So that's the second, that's for female. But for male, it's also known as the upper kidney. So basically, men that has problem with libido, unable to get up, okay, all these sexual function, it has to do with the heart. So you have to treat the heart so everybody can be happy. So I like this combination because the X39 basically like with the indication, it goes to the bones, stamina, and everything. It basically makes sense to put it on kidney 6 and lung 7 for X39. Thank you so much. I think that's all.
Wow. That I saw the camera, the screens going like that. That it was very thorough, Dr. Pamela. Thank you so much for bringing to us that information about traditional Chinese medicine. And like I said, that's how David has done our clinical studies, knowing the meridians, working with, of course, doctors and, practitioners all over the globe to impact those specific organs. So you brought a lot of knowledge to things I haven't even heard before. And I've used acupuncture for a very long time, but obviously not those specific issues. But thank you for bringing that to our patches and how these specific patches, and you mentioned 39, 49, Aeon, and Glutathione, how they directly impact the heart and things that I think are going to get people thinking as well too. And I love that, with Dr. Mario talking, where my foundation is nutrition and healthy lifestyle as well. I feel like that was, a huge component, but then you're also saying another huge component of that is the love and the releasing of those toxic feelings that we harbor, right? And so that's very important to keep our heart healthy, is that we eat nutritious, we have a healthy lifestyle, we're moving, we're doing things for our body, and yet also we're nourishing our emotional side, right? Our mental side of our body, our heart. That's a huge component of that. So I just love the two of you guys together. It's like, I'm so grateful. But Dr. Pamela, I would love for you, and you did mention just a little bit about your experience, but I would love for you to share your personal experience with the patches. And of course, everybody wants to know what patches you are using as well too.
Okay, so my first experience, remember Sarasota? So I was using glutathione then. I was like, oh my God, this is going to be horrible. But I said, well, this is basically part of the detoxification. Of course, I, just like everybody else, has issue in the past, family died, all these things. So you basically just shovel them aside. I will entertain that later, but it's no longer valid this time because the patches forces you to change your lifestyle. This is from my experience. The patches, it's amazing. it's basically not only it change, it's basically forcing you to change the lifestyle. What I mean by that, just mental aspect and also the way that you eat. So if you eat junk, right, and you like thinking, oh, I'm just gonna put the patches and I'll be fine. No, the patches gonna make you sick. So this is why people say, oh my God, I put the patches and my blood pressure like go up the roof. Yeah, because your diet is like trash. So no brainer. So it's basically the patches follows what you put in. You cannot put gasoline inside your Mercedes-Benz, right? No. So this is your only body. So if you're not gonna take care of them, right? Who's gonna take care of them? Mm-hmm. Yeah, unless, you know, like I tell my patients, I can only help you halfway. You have to meet me 50%. Because, you know, if I put all 100% and you're still not doing your part, I'm not for you. You have to find somebody else. Mm-hmm. So that's how I tell them. So this is amazing. So if you really want to change your lifestyle, or you really want to get better mentally, physically, spiritually, this is the patches to go. So I've been using, you know, I'm past glutathione. So basically I'm good. So right now I'm just maintaining with X39 and X49, and I've switched them, but mainly I use X39 when I'm at work. And guess what? And my patient basically like told me, they were like, your energy is totally different. You're doing so many things and you like doing it like super fast and you like blah, blah, blah. And you look radiant and you look younger. I said, oh, thank you. And your energy is like so good. I know, amazing.
I love it. I love it.
Yeah.
That's
so
fantastic.
Yeah. So it's good. Like I don't have to tell people. People notice how I, you know, present. Like Dr. Mario said, you have to walk the talk. You cannot be just talking. You have to walk the talk. Basically, you need to have a good lifestyle. Like it is not just taking you too much. It's basically you just have to just know what you want in life. Yeah.
Absolutely.
If you wanna have a good life, no pain, you wanna have a quality of life. So focus on that.
Mm-hmm. Wonderful. Well, Dr. Pamela, a lot of people are asking, what if they've had a hysterectomy? You brought up the uterus is the second heart, and I think some women's hearts skipped a beat there on that one. They're missing their uterus. So what would you recommend for that? If that is your second heart, what would you say to them?
Well, this is what I learned. Even though you don't have your uterus, you still have the cell body that attached to the cavity area on the abdominal area. So you still have the estrogen, progesterone, and testosterone around the area. Mm-hmm. So when you use that, right, it's still gonna stimulate. It's not gonna be like, oh my God, you're gonna create another uterus there. No, it's basically gonna balance your hormones. This is true from this is from the experience. Like somebody has total hysterectomy, okay, using X39 and 49. So she was on natural HRT, not the synthetic, the natural. So she was taking that for a few years, like at least 1 or 2 years. And then she no longer have to take that because the hormone balanced itself. So that's pretty amazing finding. I'm not sure, but yeah, it's basically like they run the blood work and they say, oh my God, this is like, oh, you decreased like this point, blah, blah, blah. I said, oh, okay, that's pretty good. So less thing that you have to take, but I'm not saying you cannot take your supplement. You still can take your supplement, right, to complement what you have. And of course, you know, do daily exercise. Meditation is important. And, you know, do Qigong, Tai Chi, walk in the nature, surround yourself with all these positive people. Yeah. It's going to be a good life.
It is going to be a good life. Well, Dr. Pamela, the last question all of them are asking me is about your slides, the information. I know you shared that with me and that I screen shared. They're wanting to know if they can have those that information or take pictures of that, what would you like me to say to that for them?
Well, you can have it. It's on YouTube. It's Dr. Stacy's.
Perfect. Okay, it's on YouTube, so you can definitely have it. You will see it on YouTube, and you can take pictures from the screens. Yes, you can definitely have that. All right. Well, thank you so much, Dr. Pamela. I am excited. I know some people are asking you questions about specific symptoms with Parkinson's as well, too. So possibly in the future, we could have you and Dr. Mario collaborate on that as well.
Oh, yes.
In the future.
I have a very good result with Parkinson patient as well.
Fantastic.
Yeah.
Wonderful.
Next time,
yes. Well, thank you so much for being on here. I'm so grateful for both of you and the information that you shared tonight, pouring into, over 450 people this evening, to be able to, give them the great information that you did about heart health. And so, yes, of course, all of the information will be recorded. I know we had some questions on here, and I tried to kind of skim down through them specifically, but if you didn't get your questions answered, please obviously get back with the person that invited you, and they can definitely help you get that information. But I just wanted to make sure everyone understood that, the technology we're talking about here is the LifeWave patches, the non-transdermal patches, and we were talking about different ones and different patches that impact the heart. So I know we had people coming in throughout the whole entire presentation. So we're not deep diving into any of the other things, but if you have a specific question, we have just a little bit more time. If it's geared towards heart health, we would definitely love to entertain those. I can let Dr. Mario and Dr. Pamela be able to address the questions if you have one. There were 100 and something questions in the chat, and so I can't obviously scroll back through all of those. I tried to as they were talking, but if you have a question specifically about the heart, I'm more than happy to talk about those, but we're not going to go into any of the other topics tonight just because of the time and our topic being heart. So if you have one, feel free to ask quickly. Okay, good. They're coming in. All right. So post ischemic stroke, I believe it says. And then someone else had asked about AFib. So let me let you guys unmute. And if you would unmute yourself, I'll add a pin to both of you, get you guys on here. There you go, Dr. Pamela. Perfect. Okay. So if Dr. Mario, do you want to talk about the stroke?
Sure. So that's a very good question, and it's kind of hard to say exactly. If I had to say which passage I would use for ischemic stroke, I certainly would say X39 and Carnosine would be the go-to patches here.
Okay.
I think between the autonomic nervous regulation, the regeneration, eliminating oxidative stress in the cells of the brain, I think could help to regenerate a lot of those partially damaged cells. I'm not sure about the total regeneration of the cells that have been damaged, which goes about the same way for the heart. I think that is something that the only time will tell as we dive into these subjects in the future. But I think that for ischemic stroke, the same thing as Parkinson's, I think X39, Carnosine, I do not see right off the bat or right from the beginning that they would interfere with any medicines that are presently given for that. As a matter of fact, patients with Parkinson's and patients with debilitating neurological disorders, I think would be helped by the benefits of the X39, giving them energy and muscle endurance and growth and all, and of course the brain function and the cognitive function. I think that would be very regenerative for all of them.
Fantastic. One other question, Dr. Mario, and then I'm going to take it over to you, Dr. Pamela. What about, and you and I talked about this quite in detail this weekend, AFib when the heart is, what would you say to that if someone is dealing with that?
Well, I've heard some testimonials about patients that may have been in AFib and they have used 2-3 patches of 2 or 3 Carnosine patches on the heart, and when they may have gone back to the regular rhythm. I have not tried myself that yet. Cardiac rhythms like AFib are chronic, disorders. And I think we need to gather more information going forward, which is one of the things that I really would like to do as part of the LifeWave, to collect more clinical data on the use of the patches, on not only how the patients feel, but also getting other clinical benefits, and not only biological benefits, but also that get translated into more clinical benefits. But you know, I have already tried it in one patient recently. I'm waiting to review his heart monitor in the next few days, and I'll see if there was a positive balance with the carnosine patch. But I would love to collect more data, obviously, without a doubt.
We'll work on that.
I have an incredible population of atrial fibrillation patients in our county.
Fantastic. All right, Dr. Pamela, would you like to comment on those two as well?
Well, I have to see the patient. So the way that we diagnose is basically like I have to see if the patient is excess or deficient. You know, many things. I have to see the tongue, I have to feel the pulse and everything. But from my experience, I basically, the way that I regulate AFib is basically like they coming in with deficiency. So you just have to tonify them. So again, the heart 5, 7, 5, 6, 7 over here is a major point for that. So again, it's hard to comment on that. I have to see that patient and go from there. Yeah.
So just a general, you would say the Aeon over there on that spot, heart 4, 5, 6.
Yes, definitely Aeon, and then patches on the back. So because the location of the heart, right, the scapular blade, right in the middle, put X39. The one heard it
on the back. On the back.
Yeah.
Okay.
Yeah.
Perfect. Thank you, guys. All right. Yeah, everybody's asking about AFib. What about if someone has a pacemaker? And we know that we have been told that you can definitely use the patches while you have a pacemaker. Do either of you have any recommendations?
I don't think that there's any. I don't think there's interaction with the pacemaker at all.
Okay. Perfect.
Nope. So I have one patient, 87 years old with pacemaker. And this is just an, you know, basically I put him on X39, just one patch. So he doesn't want to put anywhere. He just want to put right on the chest. Well, there's a point over there, run 17, and he's fine. So before he was, you know, complaining of dizziness. So he went to see his cardiologist, and the cardiologist said he has not enough blood in the heart. And then he looked at me, how do you put blood in the heart? And I said, well, that's our job to like put the blood in the heart again. So with the correct combination, it is basically like, you know, in order for you to like, the way that we, TCM does it, is basically, you have to basically like nourish the liver in order to nourish the heart. And of course, the combination of the spleen function and everything, you know, play a role on that. So, and then he went and did the test again, like check the, I forgot what is it. It's basically they check the heart again, they inserted something. And then they told him, everything looks clear. I mean, everything is fine, like just like back in 2016. Then the reason why he called me, because he's excited because there is nothing changed. It's still good. I said, well, it's good. So you're going to live until 120. That's what I told him.
120. It's fantastic. Well, Dr. Mario, we're getting a lot of questions about clogged arteries, blocked arteries, buildup of plaque, arterial plaque, cholesterol, things like that. What would you say to that?
That's a good question. I think, again, a healthy lifestyle is probably the best that you can do. I think to keep your inflammatory markers down with exercise, good diet, control of diabetes, hypertension are key to accomplish that. I think the combination of patches that we've been talking about through regulation of the autonomic nervous system, endothelial function, clearing of improvement of atherosclerosis by improving the viscosity. I mean, Dr. Pam already talked about it, how you can improve if you improve the viscosity of the blood and in the function of how the conductivity of the impulses and go between the organs, and that you can make it easier. There's a better chance of recovery, a better chance of improving overall vascular and cardiovascular health. So again, I'm telling you, it's a combination of factors. I don't think that I can tell you one particular a patch that will do that, but I think again, X39, Carnosine, Aeon, I think they all help work with one another to improve cardiovascular health. I really do.
Perfect.
Lowering of the blood pressure, lowering the systemic vascular resistance, improving autonomic nervous system, improving your energy, so it allows you to exercise and be healthier.
Perfect.
Anyway.
And somebody is asking about ventricular standstills.
Well, that's a different problem, because ventricular standstill could happen as a result of multiple reasons. It could be as a result of a heart attack. You know, you can have an acute heart attack and cause so much damage or lack of heart function that your conduction, your electrical wires completely be damaged, and your heart will stop conducting electricity. You can have a weak heart muscle that could happen as a result of multiple reasons, whether it's a virus or untreated hypertension or alcohol or chemotherapy drugs. And some of those patients can have a sudden cardiac death from multiple reasons. But cardiac standstill, I'm not really sure. I think it's a different problem, and I think we need to tackle the underlying problem first, because we can take care of ventricular standstill with a patch. We need to go, as Dr. Pam said, we need to go to the root of the problem. If there's a deficiency, we need to correct the deficiency. Nowadays, if you have a slow heart rhythm, you have pacemakers, defibrillators that can help you with that, and they have been shown to improve survival in patients with weak heart muscles that have been damaged by either toxic agents or by heart attacks or ischemia or lack of circulation to the heart muscle.
Perfect. Thank you. And Dr. Pamela, we have just like one more minute. What would you like to add to any of that was just brought up? Do you have anything you want to share with that?
Well, take care of your heart. Remember, the heart is govern the blood vessel, like Dr. Mario said. Every organ has a role to play, and the most important thing is to take care of the heart. And the condition that you asked just now, I don't have anything to add, because the way that we look at it, we don't go with the diagnosis. We have our own diagnosis, like the way that we treat patients. Like, is it excess or deficiency? This patient is anemic or not? It's just excess here, probably toxin here, history of Lyme disease, all these things. So we have to make sure, we know the root of the problem before we say, oh, this is it.
Perfect. Yeah. I love that. I love that. And that's what I want you all to remember too. They talked about the foundations of things physically, mentally, emotionally, spiritually, and also keeping in mind that everyone is different. There are no two human beings on this planet that have the same thing going on inside of their body, physically, mentally, emotionally, and spiritually. And so it is definitely a case-by-case situation. So you're going to have to consult with your healthcare provider, practitioner, doctor, of course, and or find a new one, possibly, that is open to looking at other ways to help, treat the underlying cause, as they both have mentioned tonight. So we are so grateful for both of you here tonight and everything that you shared, your amazing presentations. They're blowing my phone up and privately in the chat too. Hurry up and get this on YouTube. They have so many people, of course, they want to share with. So I'm sure we'll have thousands and thousands of people that have watched this. So I appreciate your hearts the love from your hearts that you poured into everyone tonight. I'm so grateful for you, both of you. Your hearts just are huge and mean so much to me. And I just am so in such gratitude. I'm just in such gratitude for you, and to be working with two absolutely amazing physicians in what you're doing, and your impact that you're making, I know is going to go very far. So thank you all.
It's a pleasure and an honor, and be happy to share with you again.
Absolutely.
Yes.
Don't worry. I will
Thank
have
you.
both of you on here again. I'm going to give you a little bit more time to get your studies together with your own client base over the next several months. And I will definitely, we'll make a new Heart Healthy month later on in the year. So thank you all. Thank you so much for being here tonight. Everyone have a fantastic evening. Thank you.